Hello and welcome to this edition of Physio Table Talk. Today I'd like to start off with discussing the very important matter of ACL surgery rehabilitation. This is an ever-expanding field with the number of ACL surgeries being performed increasing year upon year. The rehabilitation of an ACL after it has been reconstructed is one of the longest and most complicated rehabilitation programs that any patient will go through. It is also one of the most important because the results of a failed rehabilitation can be catastrophic. Basically, it can result in re-rupture of the ACL or the ACL graft, and once again the patient being left with either having to go through surgery, having to go through rehabilitation, or being left with a deficient knee. And this can be very costly in terms of money, time, periods of disability. ACL surgery is also not cheap. In Australia, the cost is typically around $10,000. In America, costs range anything from $10,000 to $50,000, including the hospital stay and all the associated costs. The cost of your rehabilitation after surgery is probably going to be much the same. Looking over here, possibly around that $10,000 mark. It may be less if you're doing really well with the program. A typical program of ACL rehab is going to be a minimum of 9 months, preferably 12 months. The statistics for a more successful return to sport favour 12 months over 9 months. If you are in elite sport where you can have the best of rehab and devote a lot of time to a rehab, you may be able to really move your dial back to that 9-month period. But for people at the sub-elite, not at professional level, your recreational athlete, 12 months is a much better time frame to look at to getting back to being involved in sport. Unfortunately, one of the sad things that we see at the moment is a lot of people are now looking to do their ACL rehab on the cheap. And there are a number of ACL rehab experts, and I say experts in inverted commas, who have sprung up on social media. And they profess to be able to provide an ACL rehab program that will be successful and get you back to the level you need to get to be able to return to your sport. Having looked at some of these programs and some of these influencers, it is pretty clear that their programs are entirely deficient. They fail the basics of ACL rehab as put together by important bodies like Aspetar, most other rehab protocols, the Melbourne 2.0 protocol. They do not have validated testing. They do not have progressions based on your ability or based on objective data. They do not have endpoints where the strength and testing is really adequate to enable a return to sport. There is not an adequate return to sport battery of tests to say you are in fact ready to return to your sport. There is a lot of focus on strength, but there is a lack of focus on plyometrics, running, sprinting, deceleration, change of direction work, hopping, jumping, and landing. The last two are particularly important components of any ACL rehab program and part of the return to sport battery of tests that need to be gone through to say it is safe for you to return to your sport. Now, many of these people seem to have claimed that they have rehabilitated themselves from an ACL injury or more, or have gone through a basic level of coaching and a particular system of coaching by which they now claim to have expertise in developing ACL rehab programs for other people. Unfortunately, the evidence is that this is not true. Their level of expertise and the depth of the program and the tailoring of the program is not there. They have invented many of their own guidelines, their own strength progressions, their own exercises to get to the level they say you need to get to, but they are woefully short of the standards that people who routinely do ACL rehab expect in return to sport and expect in their clients and their athletes. Amazing standards have been set by people who do this work regularly. One of the guides that we'll use in our protocols is the Melbourne 2.0 protocol, which has been developed over a number of years and through a great number of putting athletes and clients through this program. It includes objective tests and includes both time-related, but most importantly, skill and hurdle-related tests to enable progression to the next level. It involves continually using objective tests, strength tests. We use force decks, we're looking at jump measurements, we're looking at hop measurements, we're looking at change of direction. We have a variety of tests that have been fairly well validated that inform us when it is safe to progress the athlete. It is not progressed on strength alone. If you're looking to have an ACL rehab, you must pick someone who is following one of these successful protocols, who is using objective data and is using this battery of tests to base your progression. Is using appropriate strength tests and is not using just something brought about by a particular coaching ideology that thinks that certain movements are the benchmark to enable you to return to sport. Some of these programs are relatively inexpensive. Some of them, in fact, are relatively expensive without providing quality. However, it is up to you to decide where you want to spend your money. Do you really want to save money and do your rehab on the cheap? Think about what you're risking if you're doing this, which of course is a failed return to sport, prolonged period of disability, ongoing knee pain, and worse, actually succumbing to a second injury, which is a tear of your graft. If you are having problems with your rehab, if you're not feeling that the quality of your rehab is sufficient, feel free to reach out. I'll put a link for a coaching inquiry where you can fill in a form and can have a look at your program, review your program, and maybe give some suggestions of where you can improve and look at where you're up to. And also get an idea of what tests you may or may not have done. You can also do consultations via telehealth and can do some remote programming on you with regular checks and trying to utilise the strength test that we use by world-leading sporting organisations and sports medicine organisations and our world-leading Melbourne 2.0 protocol. This is where you should be taking your ACL rehab, not to some Instagram influencer. Quality rehab will cost, but the end result is definitely going to be worth it. So again, I'll put the link in here for you, and if you want to have a consultation and arrange to have your ACL rehab reviewed, or particularly if you are having ongoing knee pain in your ACL rehab and you're unsatisfied with your provider, get in touch. We'll see if we can actually have a look at your program and bring it up to standard. Until then, take care, and I wish you well with your ACL rehab.